My best and excellent good morning. This is your video on exercises, early movement. It applies for clients with hip or knee surgery. The main goal is to prevent blood clots, reduce muscle wasting, reduce joint stiffness. And we're going to start with the movement of the toes. Try to increase the toe height, or in other words, get it closer to your knee. Pump as much as you can today, or as little as 5 or as 3. Any movement at this point early on is good movement. Then at some time you're going to change to heel raises. Raising a heel, activating the posterior area of the leg, preventing specific blood pooling and excessive inflammation from happening. Supporting the heart to transfer blood to the distance area of the feet. Change to the circular motion. Pick if you want to go clockwise, then at the other time you go counterclockwise, between 5 to 10 times each circle direction. Take your time, take a deep breath, prepare yourself for higher level intensities. Then slowly slide your heel, however much you can today. And if you are in your second and third week, increase the range of motion or increase the frequency. Listen to your body, but we're always looking for the highest performance capacity. Deep breath. Use your arms on the armrest if you need to, or put your arm on the side of that chair if you want to. An early participation in physical therapy in whatever capacity reduces pain medication dependency by 30%. It improves walking speed earlier. It speeds up the return to activities of daily living and also daily paying if we're depending on performance in the job and in caretaking. Evidence shows that doing these exercises daily can reduce joint stiffness by 60% and cut deep vein thrombosis risk by half compared to the people that are inactive. To finish this video, you're going to see how there is the demonstration of raising the knee in the air. We can do it assisted with our hands early on for the knee surgery, so then the knee can kick out. So you can increase that range of motion by using gravity as well. And for the hip is also important, but we want to do it not so aggressively. The video goes a lot higher because it's meant to demonstrate. But listen to the body and don't go beyond 90 early on. That's the max. However, this is what we want afterwards, which is knee complete, moving up, the hip assuming with the quad active, range of motion, and you'll be on your way to higher level activities. Hang in there. Thank you for participating. Have a good day.